Okay, hi, we're going to talk about cheese. Cheese, by the way, is like meat jello. It is a type of meat, okay? It comes from an animal. All right, and then the joke about cheese, it's the only food that when you eat it, you look like the animal it came from. Plus, the inside of an artery, a coronary artery, atherosclerotic plaque, or an atherosclerotic plaque in the aorta, for example, it looks very cheesy. It kind of looks like a cheese pizza. Cheese is high in fat, you know, ballpark, whatever, 60 to 80% fat. And a lot of that is saturated fat, which is sort of thought to be the most atherogenic fat, but really all fats tend to be atherogenic. There's been several studies on that. There's like the green monkey study showed, you know, whatever fat you feed them, they're atherogenic. And same thing like Blankenhorn's cardiac cath data in the 1970s. Whatever fat you feed people. I don't believe in good fats, by the way. I think all fats are atherogenic. And Nathan Pritikin was onto that too back in the 1970s. Fat is bad, okay? It's not good for arterial blood flow. In addition, higher fat intakes along with higher animal protein intakes are associated with increased risk of cancer, like in particular breast cancer, for example. There's a lot of data on that. Okay, casein, the common protein in milk, has a component of it is related to casomorphins, which help to get the baby calf addicted to it. Relatively high in protein, like we spoke about. Animal protein tends to be more of a tumor promoter risk, you know. There's got more methionine, more leucine, it activates mTOR. We've talked about that in other lectures. Okay, animal protein and animal foods in general put you at a little bit increased risk for leaky gut. Milk in particular is thought to potentially increase the risk of autoimmune reactions to the pancreas, for example, potentially with MS as well. Aluminum is sometimes put into some cheeses to make them more stiff so they're easier to cut. Cheeses will often have a lot of sodium. Sodium is a vasoconstrictor, therefore it raises blood pressure, causing hypertension. Therefore it's atherogenic, meaning it increases your risk of atherosclerosis in the coronary arteries and up to the brain. Plus also, always think about the Johnson for a guy, because the arteries going down to the Johnson, like pudendals, in the ballpark of 1.5 millimeters. Coronary arteries in the ballpark of 3 millimeters. Carotid arteries in the ballpark 6 millimeters. So what I'm basically saying is, with just mural atherosclerosis along the sidewall of an artery, you're going to plug up the arteries down to the Johnson relatively early, quite often, compared to the coronaries or the carotids. So you don't want those vessels to be occluded. The other thing is, you know, myocardial infarctions can happen real quick. A lot of myocardial infarctions present with sudden death. So my advice is get this stuff out of your diet. This is why people tend to be addicted to it. I know some people are just in love with cheese, but it's not a healthy food. You can get away with a lot of stuff in terms of diet and lifestyle before 35 years of age, but the older you get, the more you want to clean up all these bad habits to keep your health as you get older. Plus, I've noticed a big difference in how long women keep their looks. I've seen some women keep their looks into their 70s. I've seen other women, they lose their looks in their 30s. So anyways, I recommend avoiding cheese.